Okay, I see we have a good number of folks on, so let's get started. Thank you again for joining us today for a webinar on how to develop inclusive health decision aids. I'll get us started by going over just a few housekeeping items before we begin the presentation. You should all have connected to audio using your computer speakers, but please note that all of the attendees will be muted during the webinar. If you have any questions, please feel free to use the Q&A feature at the bottom of your Zoom screen. We'll be holding some time at the end of the presentation to answer some of those questions. And if you have any technical difficulties during the webinar, please feel free to reach out to support@healthliteracysolutions.org for any assistance. And then lastly, the webinar will be recorded and posted in the Health Literacy Solutions Center webinar archive. And an email will be sent out to attendees with a brief online evaluation after the webinar. So if you are requesting continuing education credits, please submit an evaluation in order to receive that certificate. All right, well, I'll start this webinar by introducing myself. My name is Luisa Ramirez. I'm a digital strategist at Communicate Health. We're an organization focused on creating accessible and equity-centered health communication products. And at Communicate Health, I provide strategic guidance for developing and maintaining digital health communication products that align with best practices in health literacy, accessibility, and user experience. So I've had the opportunity to be part of our previous work in developing several decision aid tools. So looking forward to sharing what we've learned throughout our work with you all today. Kathleen, I'll pass it over to you to introduce yourself as well.
Thanks, Louisa. Hi, everyone. My name is Kathleen Walker. I'm a senior content strategist at Communicate Health, and my role is to create plain language health content and advise our clients, who are mostly government agencies and federal agencies like CDC and NIH, on how they can best reach their audiences with relevant health information to help people make informed decisions. And I've also had the opportunity to work on a few decision aids and to partner with Louisa on that process as well. So looking forward to sharing some best practices with you all today.
Thanks, Kathleen. So to get us started, I'll recap the learning objectives for today. The goal is that after today's webinar, attendees will be able to describe what health decision aids are and how they can help support health literacy and health equity. Set up a process for designing and testing those decision aids for your priority audience, and then identify some of those best practices to implement when designing decision aids so that they are clear, inclusive, and accessible. Kathleen, I'll pass it over to you for the next slides.
Great. So first, what is a decision aid? A decision aid is a tool that helps people think through complex healthcare decisions by outlining the risks and benefits of each option. So a lot of decisions that we have to make about our health actually require us to take in a lot of complex information. Sometimes we might get that information from our doctors, by searching online, by asking family and friends. People may get information about their health from a lot of different sources, and often we have to make complex decisions like whether to have surgery or whether to pursue a certain treatment option or diagnostic or genetic testing. So having a decision aid can help people walk through that process and give them key information to consider along the way, and help them really pare down that complex information that they're taking in. And there are different types of decision aids. Some decision aids are web-based tools, like interactive tools that you can use on a website, while others are printable handouts or other printed materials. So there can be many different formats that work for decision tools. And next slide. So there are a few things that a good decision aid does. First, it provides clear information on the benefits and downsides of whatever the options are. So that might be treatment options, testing options, whatever choices people are considering. The decision aid gives clear information about the benefits and downsides or risks of each option to help them weigh those options for themselves. A good decision aid also helps people think through their values and preferences. So we all like to make decisions based on the facts about our health and what we know about the options available to us, but our emotions and our personal values and life experiences all play a role in our decisions too. So with a lot of treatment options, it's important to think about what you value most and what's most important to you. For example, if there's a treatment option that would require someone to put together a complex piece of equipment every day, but that might mean that they can be a little bit more independent and spend more time doing the things they love with the people they love. Some people would take that option in a minute, and other people would say, well, I'd rather not spend that time in my daily routine putting together this equipment. That's not something that's worth my time, especially if I have limited time and energy due to my health condition. So everyone's going to value different things, and a decision aid can help people think through their personal preferences based on their experience. And finally, a good decision aid includes clear next steps. Often that next step is to talk to your doctor or your care team, for people that have multiple healthcare providers, about the decision that they're making. We don't want people to be making these health decisions in a vacuum, even if we're giving people a lot of great helpful information within the decision aid. We want them to go and have that next step with their doctor. So depending on the context of the decision they're making, that might mean going to the doctor to have a conversation about whether genetic testing or diagnostic testing is right for them. Or it might mean talking to their care team about different treatment options, and setting up the next steps to pursue those options, like a surgery, for example. So it's important to give people clear next steps once they've gone through the full decision aid and gotten all the information. Next slide. So what are the use cases of decision aids? When can we use decision aids in our health communication? There are a few different ways that decision aids can help our readers. They can help people choose between 2 or more care options, decide whether to pursue diagnostic or genetic testing, or they can also help people decide whether to participate in a clinical trial or another research study. So those are a few different ways that decision aids can help people evaluate their options and make an informed decision based on their needs and preferences. And as we mentioned, a decision aid shouldn't replace a conversation with a doctor, but they do come in handy because they can make those conversations more productive. The more information that people have and the context they have about the different options available to them, the more empowered they're going to be to ask questions when they're having the conversation with their doctor and to fully understand all the options. I know sometimes I've been to the doctor and they explain the treatment option in less than 2 minutes, and they may not give you all the information that would be helpful for you to know. So if people come in already having some of that background and context, it can empower them to speak up for themselves and ask questions about the things that they're not certain about, and really be empowered in their decision. And next slide. So how can decision aids promote health literacy and health equity? First, they simplified the decision-making process. As I mentioned, often people are navigating a lot of complex information about their health. So the decision aid really simplifies that. And that's really what promoting health literacy is all about, is simplifying health information, and giving people the information that they need to make an informed decision. Decision aids simplify information by breaking that complex information down into easy to understand chunks, which is one of our key plain language best practices here at Communicate Health, but it's especially important for complex decisions about your care. They guide patients through key factors to consider. So, for example, if someone's deciding whether or not to pursue a specific treatment option, the decision aid might walk them through how that treatment option is going to affect their everyday life, potential side effects, and aspects that might be difficult either logistically or emotionally. All of those key factors they might want to consider as they're making that decision. And as we just walked through on the previous slide, they prompt people to think about their personal values and what's most important to them. So it's not just the factual information about how this particular treatment option can help people with a specific health condition. Decision aids can also help people consider those emotional and personal aspects of what's most important to them, whether it's worth it for them, because that's often the decision that people are making is this treatment option worth it in my particular circumstances and my particular needs? So the decision aids can really help people think through those values and preferences. The next decision aids also facilitate shared decision-making, and they empower patients to have informed conversations with their healthcare providers, because patients can come in aware of their options and really ask those detailed questions and advocate for what they need. And finally, decision aids can also guide conversations between patients and their family members or caregivers. So we typically think of patients as the primary audience for decision aids, but family members and caregivers can use decision aids as well, or patients can go through a decision aid and then share what they've learned and some of the decisions they've made with their family members or caregivers to talk through some of the risks and benefits of treatment options or testing options, or just use that as a jumping off point to talk about how the treatment will affect their lives and the support that they might need. So there are a lot of ways that decision aids can be helpful in promoting health literacy and health equity. And next slide. And I'll turn it over to you, Louisa, for the process for developing a decision aid.
Thanks, Kathleen. So what is the process for developing a decision aid? Here, we'd like to share the process that Communicate Health follows when developing all health communication products, including these decision aids, which follows an equity-centered health communication, guidelines, and best practices. This process ensures that your products are clear, they're actionable, and most of all, they're inclusive of all members of your priority audience. So when starting the process of developing a decision aid, you want to start by clearly defining what is the health communication problem that you're trying to solve. Do you have any previous research or data to reference, and where are those gaps that you're trying to fill? Next, identify your priority audience and be as specific as possible so that you can ensure you're meeting the needs of the people who will be using your decision aid. And consider conducting some type of formative research with your priority audience, whether that's in the form of a focus group or an in-depth interview, to learn more about their information needs before you begin designing your tool. Here is where you'll learn more about any challenges or barriers that members of your priority audience face when searching for health information or making a complex decision. And phase 2 is where we begin the design process. So your team begins ideating approaches, maybe in the form of a wireframe or a mock-up if you're developing a digital decision aid, for example. This is really the brainstorming process where you're designing ideas to meet your health communication need. Then you begin designing a prototype of your tool. And one of the most important steps here is to test your ideas with your priority audience. So consider conducting usability testing sessions, for example, to gather feedback on your prototype and ensure that the decision aid is meeting user needs and is accessible to all audience members. And lastly, finish building and refining that decision aid to align with the feedback that you heard from participants during usability testing. Maybe based on that feedback, you decide to take a different approach in general, or you're making a few tweaks to make sure that the content is clear, the design is inclusive, and overall the tool remains accessible to everybody who intends to use it. And once that decision aid is refined and it accurately reflects your priority audience's needs and their feedback, you'll be ready to launch your tool. After a decision aid is live, we always recommend to continue to evaluate your product. CH has done this in the past for these types of digital decision aids by conducting an additional round of usability testing after a tool is live, for example, or we continue to gain feedback from our priority audience and optimize the tool. Or we've incorporated a web-based survey at the end of the tool where users can share their feedback, they can share what they've liked about a product or any challenges that they faced in accessing that information or any barriers that they've gone into. And then based on your findings from this evaluation, you can continue to refine your decision aid to better meet your audience's needs and address any challenges that users have in accessing that information that's provided. All right, Kathleen, back to you.
Thanks, Louisa. So next we'll dive into some best practices for creating decision aids. So one thing to consider as you're writing content for a decision aid is to lead with empathy. Create content that's easy to understand and really empathizes with the person who's making this complex decision. So a few tips to consider. Keep content brief. We don't want to overload people with a lot of narrative, paragraphs, a lot of information. So it's helpful to stick to brief blurbs, brief pieces of content so people can focus on what's most important. Write in a conversational tone. So we often talk about writing the way we speak, and that can be subjective. And of course, not everyone speaks using the same tone, but it's helpful to think about how would you explain this concept to family and friends, and what are common words that your users, the people who are using your decision aid, are likely to understand, and try to focus on using that conversational language rather than focusing on jargon terms. Next, use direct but empathetic language. So when people are making complex decisions about their health, it's helpful to be direct and really clear about what the options are. But sometimes those decisions can be really difficult. For example, sometimes people might be facing a health condition that really causes difficulty in their day-to-day life, and there might not be great treatment options. Maybe there are a few different options they need to consider, but all of them will require some time and effort every day, or they come with side effects. It's important to be direct about what the trade-offs are, and what people can expect if they go with the different treatment options. And balance that with empathetic language. So that can mean acknowledging the emotions that people might be experiencing as they're making these decisions, acknowledging that the process can be hard, or that there may be conflicting information about the topic, or that navigating life with a certain health condition can be confusing. All of those, just kind of acknowledging what people are going through, and considering the user's perspective as you write, can help to bring in some empathy into your approach. Next, consider including some content about the emotional and financial aspects of care decisions. So we've talked a little bit about the emotional aspects in that whether using a certain treatment, using a certain medical device, or pursuing a certain treatment option will be stressful or require time and effort every day, or require some significant trade-offs in terms of side effects or quality of life. All of those are highly personal and emotional decisions, and it's okay to acknowledge that, and maybe even give people a heads up about some of the emotional aspects that they may experience. So in this example, we have a screenshot here of a page from our My ALS decision tool, which we'll look at in more detail a little bit later on. But this is a decision tool for people living with ALS that describes the process of genetic testing for ALS, and goes through the benefits and downsides of genetic testing. And in this screenshot, it's explaining the emotions that might come with genetic testing. So we mentioned that the process can be overwhelming or confusing, and you might feel anxious as you wait for your results. And learning about your results may bring up difficult emotions for you and your loved ones. So again, thinking about people's relationships with their family, and the fact that these health decisions don't exist in a vacuum. They affect people's everyday lives and their relationships too. And for the financial aspects, it may be helpful. I know with the way that our US healthcare system works, it's not always possible to give people a detailed perspective on how much a certain treatment option will cost or what they can expect. But it can be helpful to give just a general idea if something is quite expensive by anyone's standards, or is rarely covered by insurance, or it's something that you might need to advocate with your healthcare or health insurance provider to get. It's helpful to give people a heads up about that, and just the fact that there may be a trade-off involved in the financial investment or having to deal with insurance in order to pursue a certain treatment option. So acknowledging that financial piece and health insurance coverage is part of the decision-making process as well. And finally, talk about how each option that's presented in the tool aligns with values, beliefs, and personal preferences. So again, just linking those logistical decisions and factual decisions and pros and cons back to what's most important to the user, what do they value, and helping them think through their personal preferences based on their own experience. And next slide. Next, it's important to have a clear and interactive user interface. So again, we're breaking those complex processes down into steps and limiting the amount of content on each step or each page. And then help people personalize the information and apply it to their own lives with interactive elements like yes or no questions. And finally, we always want to include clear next steps, not just in terms of what people will do at the end of the tool, but as people proceed through the tool, we want to have a really clear place for them to go to the next step or the next page and help them understand what will happen next throughout the decision aid experience. And next page. Next, we want to take an inclusive approach to our design. And there's a few different ways that we can help to make sure that these decision aids are easy for everyone to read and understand. So first, use numbers wisely. So in a lot of cases, there are many numbers that doctors might share in terms of considering the medical outcomes associated with different types of treatment options or testing or any number of medical decisions that people might need to make. So as health communicators, it's helpful for us to think about what numbers are actually relevant to our audience. What numbers do people actually need to know to make a decision about their health, and really limit the numbers that we're using to those that are most important for people to know. It's also helpful to supplement our written content with graphics or videos. So in this example, we have another page from our My ALS Decision tool. This is a part of the tool that focuses on making a decision about whether to use a feeding tube. And here we have an image of someone who has ALS with a family member. And this was actually an image that was provided to us by the Les Turner ALS Foundation, which was the organization that we partnered with to develop this tool. But often we may not have images that are provided by the client or images that reflect our priority audience already. So if we're choosing stock images, make sure to choose realistic and candid images, and make sure that the people in the photos really reflect your audience and the people who are going to be using the decision aid. And next slide. Next, it's helpful to include some progress indicators. Just like we talked about with next steps, it's helpful to give people an idea of how far they have gotten through the tool and how far they have left to go, especially for people that might be kind of processing a lot of complex information. They might already be feeling overwhelmed. It's helpful to give people an indication that this is not going to take forever. It's a short process to complete the decision aid. So using a progress bar or just including the total number of questions and how many questions people have completed can help people to visualize where they stand in the tool. And next slide. Next, it's important to test your decision aid with your priority audience. So that's something that we did as we developed the My ALS Decision tool. We tested different sections of the tool with people with ALS and caregivers who support them to make sure that the decision aid was relevant to the information that people needed to know and reflected the real questions that people were asking, and also to make sure that it was accessible to people who might have challenges with using a keyboard or might use accessible devices like a screen reader or other devices to help them navigate. So that testing is really important to get that feedback from your priority audience. Another way to help people get clear next steps at the end of your decision aid is to consider providing a printable summary of the choices or decisions that people have made throughout the tool. This can be really helpful because people can just print off that summary and take it to their appointment to discuss with their healthcare provider. And for people who, again, might be feeling overwhelmed, or people who struggle with memory and cognition due to their symptoms of their health condition, that can be a great way to document the decisions that they've made. And it's also helpful to wrap up with showing, providing additional resources where people can learn more about the topic. And that really helps us keep our content within our decision aid streamlined as well. For example, with the My ALS Decision tool, we didn't try to include every piece of information that people need to know about ALS. That would be a really long tool, and it would not be focused on the key decisions that people need to make, like, do I want to use a feeding tube or a breathing support device, or do I want to get genetic testing? This particular tool lives within the Les Turner ALS Foundation's website. So we linked out to a place where people can learn more on the website and look at guides that are related to topics like ALS and breathing or ALS and nutrition, to learn more about those topics, right there on the Les Turner ALS Foundation website. And that allowed us to keep the content within the tool really streamlined and focused on the key decisions. And next slide. So next, we'll go into a little bit more detail with a case study on my ALS decision tool. So as I mentioned, Communicate Health partnered with the Les Turner ALS Foundation to create this tool to help people living with ALS make informed decisions about their care. And the tool has 3 modules or 3 sections so far. Those modules cover important topics that people need to consider through their journey with ALS, which include 2 treatment options, which breathing support and nutrition support. And then we also have a module about genetic testing. And people living with ALS can get genetic testing to learn more about the reason why they may have developed ALS, if there is a genetic cause for their particular case. And then often, based on their genetic testing results, people can find different treatment options that are better suited for their particular needs, or potentially they may be eligible to join a clinical trial or research study, which could also expand their access to treatment options that are being tested. So there's a lot of benefits to genetic testing, but it's a very complex process. So we created that module to help people understand how genetic testing works for people with ALS. And next slide. So this tool explains ALS treatment and care options in plain language and guides users through those complex decisions. And users answer a series of questions about their needs and values to help them understand the potential outcomes. So in this example, we have a screen that talks about the disadvantages of using a feeding tube. And here we are allowing users to select the disadvantages that matter to them. And so here we talk about the cost of a feeding tube. We mentioned that it can be expensive, but most insurance plans will help to cover the cost. And then the logistical aspect of taking care of the feeding tube, that is a responsibility that people would need to take on or have a caregiver to assist them with. So again, helping people to think through those downsides and allowing them to save the disadvantages that are most important to them so they can go back and consider them later. And next slide. And this tool also provides a summary of the user's responses and links to ALS resources to facilitate informed conversations between people living with ALS, their families, and their care teams. So as I mentioned, it's helpful to provide a summary at the end. Some people living with ALS do have symptoms that impact their memory and cognition. And I think it's helpful for everyone to have a summary of the key takeaways of what they've learned. So the screen just gives a quick recap of the main messages of the tool, the main information in this case that people need to know about using a feeding tube. And then it lists the benefits and the disadvantages that people said were important to them. So here, this user in this example had selected the benefits of lowering their risk of choking, making meal times less stressful, and maintaining their strength. And they said that taking care of the feeding tube was a disadvantage that mattered to them. So having all of that information here on one screen helps people to remember what stood out to them as they were thinking through the pros and cons. And next slide. Next, with ALS in particular, there's a lot of complexity in not only the medical content of explaining ALS is a very complex disease, and it's important to break down how ALS affects the body in a way that's relevant to the specific treatment options that people are considering. So for example, when we're talking about breathing support, it's important for people to understand how ALS can potentially affect breathing. Same goes for nutrition support. People need to be able to understand how ALS might affect their ability to eat safely, to chew safely, and affects their weight and their nutrition. And for genetic testing, people need to understand what they can learn from genetic testing for ALS and how that information might be helpful to them. So it's important to break down that complex information into short chunks and accessible language. But it's also complex in a sense of just the emotional process of learning about your ALS diagnosis, coping with the obstacles that come with living with ALS and the treatment options that may be required. And there's just a lot of logistical aspects and difficult emotions that may come up throughout the process. So it's important to use that empathetic tone and really make the content friendly and accessible, while also acknowledging the realities of living with a progressive disease. And on this, in this example, we have two screenshots from the genetic testing module here. And one of these screens shows the limitations of genetic testing, which was one of the most difficult slides to develop because it's a complex topic. Genetic testing shows a lot of promise, especially for future treatments for ALS. And the Les Turner ALS Foundation wants to encourage people to look into genetic testing and consider pursuing it because it's something that can be helpful for many people living with ALS. But at the same time, we don't want people to go into genetic testing with an expectation that they're going to get a black and white answer, that everyone's going to get a very specific answer about the reason they developed ALS and what they can do, or a treatment option that's relevant to their particular situation. In some cases, genetic testing can detect certain genes that are associated with ALS, and people might be able to get into a clinical trial because they have those genes. But for other people, a genetic component might not be found. And so they might feel like, I went through this genetic testing process and it was kind of an emotional roller coaster. And now I don't really have any more information, right? So that could be a frustrating outcome. So on this screen, we were going through those limitations and explaining what people may not be able to learn from genetic testing, understanding that the science is still developing and it's an evolving field. And here's what you can get out of genetic testing at this point in time. And finally, this other screen explains the process of how genetic testing works. And it just goes through the logistical steps of getting a blood or saliva sample, sending that to the lab, and the process of what the lab would do with that sample, and then waiting for your genetic testing results and discussing those results with your care team. And next slide. And as I mentioned, we conducted usability testing with adults living with ALS and their caregivers. And this was a really critical part of the process of designing this tool, because we made several design and content updates based on the feedback of our testing participants to improve the usability of the tool. For example, we added spacing between the buttons to make it easier to navigate for people with mobility loss. And we also used larger fonts and buttons throughout the tool. And next slide. So we've received some very positive feedback on the tool's warm tone and approachable content. We've had some great responses from people living with ALS and people who follow the My ALS Decision tool online. People have really appreciated this tool, and I think it's really filling a gap that there's not a similar decision aid for ALS, at least in the US. I know there's an example in Australia that the Les Turner ALS Foundation had shared with us, but for American patients, there's not much information out there to help them simplify this decision-making process when they have so many complex care and treatment decisions to consider. So I think this tool really filled a gap. there. And the tool also won a Clearmark Award from the Center for Plain Language in 2022, which is an award that recognizes health communication materials that are easy to understand and use. So we were glad to see the My ALS Decision tool honored with that award, and really glad that it's had a positive impact for people living with ALS. And next slide. And I'll turn it over to you, Louisa, for the My Health Finder case study.
Thank you. So for our second case study, we're sharing a decision aid tool that Communicate Health developed in partnership with the Office of Disease Prevention and Health Promotion for their My Health Finder microsite. My Health Finder provides consumer health information that's written in plain language, and it's based on evidence-based clinical preventive service recommendations, like vaccines, screenings, or other tests that people may get. And as part of the microsite, we have an assessment tool on the homepage where users can input their age, sex, and pregnancy status, and that get a personalized list of recommended clinical preventive service recommendations. So recommended vaccines that they may need, or other screenings and tests, which may include colorectal cancer screening. So as part of that website, we developed an interactive web-based decision tool to help people decide which colorectal cancer screening tests may be their best option based on their values and their preferences. Because sharing a recommendation for a specific screening test is challenging and it requires attention to the questions asked and the logic set for that tool, we worked closely with federal subject matter experts to develop that content and ensure that it accurately reflects not only clinical preventive service recommendations, but that we're providing users with clear and actionable health information and next steps that they may need to take based on the results of that test. So the tool guides users through 7 questions. We have an example of one of those questions here on the right. And these series of questions help users learn a little bit more about the different types of screening tests that are available for colorectal cancer. It prompts them to think about and identify their values and their preferences as they're related to which type of test to get, and then use this information to make a screening plan with their doctor or their care team based on their results and based on their preferences. After users answer these questions, they're then directed to a results page where they're provided with a recommendation for the specific type of screening test that they might prefer based on their responses. And as you'll see in the example images on the screen, this is a results page broken down into 2. So users are provided with their recommended screening test. It repeats users' answers, so they have those for references and they can take a look back to their responses on what was most important to them. It also includes clear next steps, like talking to their doctor or their care team about their results and any other specific questions that they may have after taking this test. It also includes information about the other types of screening tests that are available if people want to learn more about those other options that weren't presented to them as part of their results, or they might want to learn a little bit more about some of the options that are available. It also provides users with some additional links to view more information on My Health Finder related to colorectal cancer screening. So for example, we have a general topic about getting tested for colorectal cancer. We have another page around any questions that they may want to ask a doctor during a visit. And then lastly, a list of conversation starters. If somebody wants to talk to a loved one about getting this type of screening or test, they can visit this topic and get more information about how to start that conversation and encourage people to get a screening. And then lastly, it provides users with the option to retake the quiz if they'd like. Maybe they want to revisit some of their answers or some of their responses based on some of the additional information that they learned on this results page. And that brings us to the end of today's webinar. Thanks all again for joining. We hope that these best practices and these 2 case studies that we shared reflecting these guidelines are going to provide you with the tools to design clear, inclusive, and accessible decision aids, and that these decision aids can support shared decision-making between patients and providers, and ultimately empower patients to be more informed and have productive conversations with our care team. So I'll transition us now to the questions and answers portion of the webinar. So please feel free to use the Q&A box at the bottom of your screen to type in any questions you have, and we'll get to as many as we can in the remaining time. All right, I see some questions coming in, so happy to answer a few of those. The first is, what web platforms or frameworks like WordPress were used to develop these tools? So for the My ALS Decision Aid tool, we use WordPress to develop that. And for the My Health Finder tool, we use Drupal. So both are content management systems that allow for some development support, but also for folks without a development background to update things like content and images so that they can be regularly kept up to date and make changes. The next is around sharing the Equity Centered Development Framework. And absolutely, this is actually included on our website. So that's communicatehealth.com. There's a link to the framework that we published a few weeks ago, and I'm happy to actually share a link to that in the chat box shortly. All right, the next is any examples of decision aids around nutrition and wellness. Kathleen, do you have any that come to mind?
Yeah, that's a great question. I think the closest one that I have worked on personally is our ALS decision aid around feeding and nutrition support, which is not necessarily the same topics that are going to be relevant to a wider audience. So I haven't worked on one myself, but I can see how decision aids would be really helpful for a lot of treatment decisions related to nutrition. And I see we have another question about, have these tools been utilized with infectious diseases such as HIV, and how have they been received by the community? I haven't seen any decision tools related to topics like HIV or other infectious diseases, but I'm curious if you have, Louisa.
I haven't off the top of my head, Kathleen, but I'm sure that there's some information available related to that.
And I see we have a few questions in the chat too. I see someone asked, do you have examples of paper decision-making handouts that you've created? I think I have personally only worked on online decision aids. I think we typically see those more often today. The closest thing that I've worked on as a printable material would be at CH, we have created conversation guides for patients to talk with their doctors about complex topics. For example, I know for the National Eye Institute, we've created talk to your doctor guides about how to approach the conversation about certain eye conditions. And those guides usually include kind of a framework with questions for patients to ask their doctors about their condition and treatment options. And on the flip side, I've also worked on materials with conversation starters for doctors to help them structure conversations, especially about vaccination. So helping facilitate conversations between providers and parents about getting their kids vaccinated, and dealing with some misinformation and any hesitations that parents might have about vaccination. So those are in the neighborhood of decision aids, but not quite decision aids in the same way as some of the online tools that I've worked on. Louisa, have you seen any more paper-based decision aids recently?
No, I think the examples that you provided are some of the most recent ones that I've seen as well, Kathleen. I know at least for Communicate Health, our experience has been on the digital side.
And I see we also had a question about what strategies do you implement to ensure equitability in comms efforts? And I know that the framework for equity-centered health communication that Louisa just posted the link in the chat, that's a framework that CH just published a few months ago, and it definitely goes into a lot more detail about how we center health equity in our work. But one thing that I personally think is really critical is taking time to listen to the priority audience that we want to reach, and really co-creating, involving people in the process of creating resources as much as it's feasible with the budget and with the client that we're working with. And with the example of the ALS decision tool, I think that including people in usability testing was a critical step to help us make sure not only that the tool was accessible, but also that we were covering some of the decisions that people had about their treatment options or about genetic testing. So I think that's a critical piece, and we definitely have more strategies in that equity-centered framework as well.
Yeah, and I'll just add to that too, Kathleen, at least for the MyALS decision tool. One of the strategies we used was in terms of usability testing, being really intentional in our recruitment process. So, asking folks with a mix of abilities, some with some mobility loss, folks who use assistive technology devices to search the web, to participate and provide feedback. So some of the folks on our sessions used eye gaze software, for example, or they used a keyboard device or a speech generating device. And that mix of feedback and folks using different technologies really helped us identify any gaps in terms of accessibility and improving the usability of the tool. And I see there's another question related to usability testing. So how many end users do you recommend testing with? And do you test with folks who have not had input on the original design and content? So there's a lot of information about how, really the best results with usability testing can come with really no more than 5 users. And the preference in running some of those smaller tests so that you can test more often and get some additional feedback when needed. For the MyALS decision tool, we did test that twice. We tested the breathing support module once, and then we tested a prototype of the genetic testing module that we developed about a year later. And both of those sessions were with 5 participants. And we found that, we did get a lot of really insightful feedback on the design, the content, and again, just some of the gaps in usability and making sure that the tool was as accessible as possible. So we've had a lot of success with using that number 5 in our usability testing. And yes, there were folks who did not have an original input on the design and content. So they were seeing the tool for the first time as part of their sessions. And then for the time frame for either of those, I know for the MyALS decision tool, the first couple modules took between 10 to 12 months because we were really starting from scratch. So we really had to think through the logic of the tool, the structure, the user flow of that decision aid. When we designed the third module around genetic testing, that was a bit quicker. So that took around 8 to 10 months, I want to say, because we already had sort of the structure in place and we were creating an additional module to fit that existing layout.
And I see we also had a question about what feedback have we received from clinicians about the 2 decision aids that we presented? So I know for the MyALS decision tool, we did receive some feedback from clinicians and genetic testing counselors who are connected with the Les Turner ALS Foundation that found the tools very helpful and especially in helping to guide people through those complex medical decisions. And we had a few professionals note that these tools really filled a gap that they were seeing in the field. And we also, I didn't mention this earlier in the process of developing the genetic testing tool, we really leaned on feedback from genetic testing counselors as well as usability testing feedback from the folks with ALS who participated in our research to make sure that we were including the questions that their clients tended to ask about genetic testing and make sure that we were explaining the scientific elements in a way that was easy to understand and also scientifically accurate, since the knowledge about genetic causes and genes linked to ALS is always evolving. We were very precise in the language about that. So we got some great feedback from our clinicians, and that feedback also helped to shape the tool. And Louisa, I'm curious if you received any feedback from clinicians on the MyHealthFinder tool.
Yeah, definitely. I mean, that, like I mentioned, that was a really close partnership with subject matter experts, just because, recommending a specific screening test is so challenging, and we wanted to make sure that any information that we recommended was very true to clinical preventive services. So it was definitely a close partnership and a process to draft that content with subject matter experts and that get their review throughout the process, and have them look at the final tool to just make sure that they were feeling confident about the logic set, and we were providing users with the most accurate information to date.
And I see we had another question in the chat. Do you find creating decision tools challenging at times, getting information from clinicians who may be included in your research? I think one of the most challenging aspects as far as the content is just finding the right balance. I think especially when we are working with subject matter experts like clinicians, finding the right balance in making sure that we are scientifically accurate, that we're using very precise language that's accurate to describe the treatment options or testing options without weighing people down with too much information, and really considering what are the most critical factors that people need to know as they make this decision. And some of you may have experienced this, but often clinicians and subject matter experts like to give people all the information about a topic, or, make sure. I think sometimes people have the idea that accuracy means providing all the details, and that can be a complex balance to figure out. And even for me personally, I like to have a lot of information before I make a decision. So I can completely understand that. But I think as health communicators, we know that for the majority of people, if we give them too many details, that can be overwhelming. So I think we try to find a balance in making sure that we're including the key points and including the details that our physician and clinician consults think are most important, without making it overwhelming. And I think that was particularly a challenge with genetic testing around the language, because what we found is even the language that is commonly used in online resources, or the language that our partners at the Les Turner Foundation might use in everyday conversation, might not completely align with the language that clinicians who are completely 100% focused on genetic testing are using. So I think nailing down that language with our subject matter experts was one of the biggest challenges, but it is also really a critical part of these decision aids, because it's important for the decision aids to reflect the language that people are likely to hear from their doctors. If we use one term in the decision aid and a doctor uses another term, people might not realize that they're referring to the same concept. So it can be challenging, but it's an important piece of the puzzle. Let's see if we have any other questions. Yeah, I see we have a question about, do you charge for your decision aids? So at Communicate Health, we typically partner directly with clients who are part of major organizations, and we do charge for creating these decision aids. I know occasionally we do take on pro bono work on a case-by-case basis as well. Great. Any other questions before we wrap up?
I see there's one other question in the chat. Since you're a professional health communications business, how do we know when to create our own decision aid versus outsourcing the job? In our experience of both of these tools, we partnered with an organization, so partnered with the Les Turner ALS Foundation and ODPHP to develop these decision aids. So they were providing, the subject matter expertise, certainly providing some draft content and partnerships with folks who would be reviewing. And we're really owning that design, testing, and development process for them as health communication consultants.
And I think one aspect to consider with that is I think it is helpful to think about the distinction between having subject matter expertise within your organization and having health communication expertise and user experience and web design expertise. I think you need all of those pieces to make a great decision tool. And many organizations might already have folks in all of those roles. So if you have, say, a communicator and a web designer on staff, then it might make sense to make a decision aid in-house. If your organization is more focused on say you have a lot of clinicians, you have a lot of subject matter expertise on a particular topic, but don't necessarily have someone who's focused on that plain language health communication work or design, then that might be an opportunity to outsource or partner with another organization that has that expertise. Great. Well, if we don't have any other questions, I know we are almost at time, so I think we can wrap up.
Great. Thanks for joining, everyone. And thank you so much for the questions as well.
Thanks.